that we have got various zones on our face. That is the forehead, eyebrow area, cheeks, neck, hairline, ear, and jawline. Okay. Now, every area tells you something about your internal organs or about your skin type. Okay. So, what is that? See, if you have got lot of problem on your forehead and nose, that means there is lot of stress. Then hair product what you are using are not suitable to you. Okay. Touching with unclean hands. If you are going outside by bus, train, and then you touch your forehead, then someday or the other you are going to get the reaction over there. Okay. Usually, whatever face problems you are having, remember that you are not patient. Okay. You are not someone who is ill, but you are getting pimples, you are getting pigmentation, you are getting various problems. That's what we will see step by step. Okay. Then, if problem is only present on the hairline, okay, just parallel to hairline, that means either hair wax, hair gel, hair pomades, hair oil, hair creams, whatever you are using it in a wrong way. And that's why it is causing you all the problems. Okay. Same way, eyebrow area, if there is a problem, then some kind of your makeup is at fault, your brushes, your products will be at fault. If you are getting acne pigmentation on the cheek, then either your dirty pillowcase, okay, that can cause problems. I will tell you one interesting case about under eye circle. See, it is very common problem that people get under eye circle. I had one patient and she was about 55-year-old lady having under eye dark circles. And she had seen 3, 4 big and renowned dermatologists, cosmetology practitioners, and more or less all the whatever treatment she has received was all the same. Okay. And there was no result. So when she came and sat in front of me and I started having consultation with her, then gradually I realized that she has taken all the treatment and that too from all good doctors, from all good cosmetology practitioners. Then what to do? Because see, whenever patient comes to you, know, and that time suppose you are not able to give any kind of treatment, then where the patient can go? Now patient had already seen 3 and 3, 6 good people. I remembered my college days when my teacher in Nair Hospital, it was in 1990. Okay. So that time my teacher, Dr. V.R. Joshi, he had said what, whenever you cannot come to conclusion about your patient, go back to history. Go back to history. History taking should be revisited. He didn't suggest that you do PET scan, MRI, and this and that. Nowadays, if you see at every drop of the hat, you are advised PET scan, MRI scan, CT scan. It has become a routine. So I went back to history taking and I started taking that patient history as if I am new to her and she is new to me. So when I examined and I asked her about her day-to-day routine, some startling facts came in front of me. You know what patient said? In the night, when she tries to sleep, she is not able to sleep. It happens with us or with everyone, isn't it? Not able to sleep. But that particular case, she said, in order to close eyes forcibly, she is applying Amrutanjan to under eyes. You know that Amrutanjan, no? For headache and body ache, they are applying. So that thing she used to apply to under eyes so that that menthol vapor comes and eyes she has to shut. She feels little bit cooling effect and she. And when I asked her for how long are you doing this, she said for last 5 years. So the cause of under eye circle in that 55-year-old lady was only one faulty habit. Then I gave her proper counseling, proper advice, and whatever existing dark circles were there, I managed that in about 3 to 4 weeks' time. And then after that, she never had this kind of. Now, what all those 6 doctors, was there any kind of mistake? No. But history taking was not done properly. Whenever you get any complicated cases, instead of relying on investigation, go back and revisit your history and you ask the patient, why? Hair fall? Why hair? So many times patient comes and sits in front of me, and they are saying, doctor, we are getting hair fall. I am getting hair fall since the last 5 months. My second question, what is it? Why are you getting hair fall? I ask them only, why are you getting hair fall? Then they are speechless. Because this kind of question nobody had asked them. Everybody had immediately given a printout of big prescription. So then when they start talking, no, then I know, yes, this is the faulty habit number one, the second faulty habit, third faulty habit. So first you have to correct that. And that is what is important. Because here, whenever you are looking to manage cosmetology patient, you should know what is the skin type of your face, of your patients. So let us see now what are various skin types. Various skin types are normal skin, oily skin, dry skin, sensitive skin, and combination skin. These are the 5 types you will always come across. There are few advanced, but those are pathological. So these are the 5 important skin types. Normal skin, remember, normal skin is not always a finding. For 12 months, for 365 days, nobody can have normal skin. Forget. Everybody will have oily skin somewhere dry skin. So combination skin. Normal skin, never aim to give your patient a normal skin. That is impossible. You should give a balanced skin. If there is oiliness, then reduce the oiliness. If there is dryness, then reduce dryness. If there is sensitivity type skin, then see to it that skin immunity you are able to increase by your local treatment. And if it is a combination skin, then all the products should be combination type. Do you know what usual mistakes are done whenever patient has got combination skin? Then either doctor prescribes or any YouTube or any Instagram influencer prescribes one particular cream, like a magic potion, panacea for all type of skin. That is not possible. They either advise you retinoic acid, or hyaluronic acid, or vitamin C, or niacinamide. Okay, by doing all 1, 2, 3, 4 juggleries, but don't do like that. Today, if you have dry skin on forehead, tomorrow you can have oily skin on forehead. Same patient. If you have dry cheeks, day after tomorrow you can have oily skin. So your product needs to be tailored to your current state of skin type. Never give prescription for more than 7 days. कि ये एक पर्टिकुलर क्रीम है, 1-2 महीना लगाओ और मुझे 1 महीने के बाद भी दिखाओ. नो, नथिंग डूइंग. Maximum 6 days, 7th day you have to reassess and you have to modify, you have to change the prescription. This is very important. Okay. All these things you are getting live and on our Akar Skin Solutions YouTube channel. If you are not yet subscribed to Akar Skin Solutions YouTube channel, then do subscribe. I will be sending you the link, and in the description also the link will be there. Okay.
Already subscribe, sir.
You are subscribed?
Yes, sir.
Good. Now we will see what are your skin care routine steps. Okay. Because unless and until you know, you cannot advise. Okay. So why I am telling you this? Because not only it will help you, your family members, your relatives, friends, but all your patients, your clients, your customers, you can advise them. This is the basic needed advice, and you can tailor it according to the each and individual. So first step is always using cleanser. Cleanser is usually an alkaline lotion which will wash up all the dirt on your face. That is number one. Number two is toner. Toner, hardly anybody uses toner. After cleanser, they just dry it and apply moisturizer. But toner will balance the pH. Because your cleanser is going to cause a lot of dryness. It is going to remove all the surface oil. So you need toner. Okay. So second step is toner. Third thing is application of serum. Serum can be hydrating serum. It can be anti-aging serum. It can be gold serum. It can be radiance serum. Okay. If you want, I will take a separate session on serum only. Okay. Next thing is the spot correction cream. Spot correction means either acne spot, pimple spot, pigmentation spot, brown spot, black spot, whichever spot problem you are having, freckles, those spots should be corrected now after applying serum on all face. After that comes the under eye cream. So your fifth step is under eye cream. Sixth one is moisturizer. क्लिंजर के बाद में मॉइस्चराइजर नहीं है, बीच में 4 स्टेप्स है. आई विल रिपीट these 6 steps: cleanser, toner, serum, spot correction, eye cream, and sixth one is moisturizer. After that is sunscreen. After that you apply sunscreen. Whenever you apply sunscreen, it should be according to your skin type. Okay. After applying sunscreen, there is something called as lip plumber. Then you go for your lips. Primer. After that, applying primer, you can apply foundation cream or BB cream. Suppose you want to do any kind of makeup, then what you can do at the end, after applying sunscreen, 7th step, you can apply primer on full face. Then you can apply your foundation and or BB cream. That is the name of the foundation. Then you apply concealer. Concealer to conceal any kind of artifacts on your face. Next thing is the powder. Okay. Next thing is the powder. Last is the bronzer. Usually bronzer is not used in India, but for in European countries, they use bronzer. Okay. But you should be aware. Next is the blush and highlighter. Okay. And again, blush, if you apply it on this area, then that is wrong. Okay, it should be on the outer and uppermost area. Okay, outer and uppermost area. So if you apply blush anywhere, no, it looks bad.
Mm.
Last one is the setting spray. Setting spray you apply so that whatever you have applied, no, it remains there. And I am not sure whether you are aware about setting sprays. Hardly anybody is using setting spray. Okay. So to recapitulate, these are the 14 steps: cleansing, toning, serum, spot correction, eye cream, moisturizer, sunscreen, primer, foundation, concealer, powder, bronzer, blush, highlighter, and last is the setting spray. So when you use all these things, no, these are the steps, okay, for your skincare routine. And this skincare routine, you have to do it whenever you are going out, whenever you are applying any kind of makeup. Otherwise, in the night time before going to bed, there is a different routine. Morning time, there is different routine. We have got video on which Alia Bhatt, she is guiding about daily her skincare routine. Then we have got Madhuri Dixit's video on night care routine and skincare morning routine. There are 2, 3 videos you can see, go through our channel, Akar Skin Solution. You will come to know a lot of information. Okay. In case of any doubt, do contact me on WhatsApp number or on our YouTube channel also. Okay. See you in our next session